Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Ivf Options.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, I'm Dr. Amy. I'm a fertility doctor here in the San Francisco Bay Area. A lot of you guys, you probably already know so much about this stuff, but I'm hoping that you're going to learn something new that you can take to your fertility doctor and feel more empowered as a result of participating in today's session. So the first thing I want to talk about today is assessing your fertility and what you can do to improve your chance of success. Why? It's because it's so important to know what your diagnosis is before you do IVF. I know that sounds so weird, so lame. Like, isn't IVF supposed to fix everything? And the answer is no. So I've come up with something called the Egg Whisperer Diet. For those of you who don't know, I was lovingly called the Egg Whisperer by one of my sweetest and dearest patients. And then she bought me a website called eggwhisperer.com and that as a gift. And that's how it all started. So I've used these terms to kind of help patients, remind them basically like what to ask their doctor and how to be more empowered and more informed. My mantra is test, don't guess. Very simple words to remember and live by. So the Egg Whisperer Diet, D is for diagnosis, I is for your IVF cycle, E is for embryo transfer preparation, and T is for transfer. So that's what makes up the diet. It is my recipe for success. So the D, you guys, diet is like our diagnosis. How do you figure out like what your diagnosis is and why does it matter? Well, it actually matters a lot. You want to make sure that your doctor is planning your IVF cycle in a way to address the diagnosis. I'll share a scenario with you. The other day, I did a second opinion consult and the husband had low motility. Motility was around 15%. And no one really told them that that was the diagnosis. They thought they were, unexplained, which in my world or in my mind and in my world means that no one explained it enough to you. So the doctor, guess what? They did IVF and they did not do ICSI. ICSI is where you take a single sperm and put it into the egg. So if you think about it, that could be pretty frustrating when you wake up after the egg retrieval and find out that there are no fertilized eggs. So the diagnosis, if you had understood it and you had designed your IVF cycle to basically address it, that could have been prevented. You wouldn't have learned your diagnosis the hard way. So do whatever you can to talk to your doctor about what have you ruled out about me? What do you know about me? And if they say, oh, it's unexplained, if you're a 44-year-old who was told it was unexplained, I can promise you it's not because it's unexplained. It's because you're 44 years old. So you want to talk to your doctor about what can I do that's in my control to give myself the best chance of pregnancy? And if you're telling me it's unexplained, what are the possible explanations for me? And then you can use the words, what have you ruled out? What have you ruled out lately? I mean, there should be a song that goes in there somehow. But another mnemonic, you guys, and that is the Tushy Method. That's how you get to the diagnosis. The 5 steps to figure out your fertility. Seems complicated? I try and make it not so complicated. Life is complicated enough. Tushy Method, here we go. T for tubes, U for uterus, S for sperm, H for hormones, Y for your genetics. Easy. You can get it all tested in 1 month. If it's been more than a year, do it again, especially if you're going to do IVF here, especially if your doctor is telling you your diagnosis is unexplained. So in one cycle, your period starts, cycle day 3, get your FSH, estradiol, AMH, all your hormones in your preconception labs drawn. Do your carrier screen and chromosome analysis if you haven't done it already. Order your HSG done between cycle days 8 through 10. Get an ultrasound done between day 3 and day 8 through 10 so that if you have, let's say, a big fibroid or a big ovarian cyst, you want to know that before your HSG appointment. Order a semen analysis. If your site, because of COVID, isn't doing a semen analysis right now, no big deal. Meetfellow.com/Egg Whisperer. That's how you can get a do-it-yourself semen analysis kit delivered to your home. If only for women, it could be that easy that we could just put our eggs in a cup and send them off to be frozen or analyzed, but it's not. Until then, we gotta sleeves up, pants down. You know what I'm talking about. So super important to find out what your diagnosis before your IVF cycle. So now let's talk about preparing for your IVF cycle. The things that I talk to my patients about are this: look at your lifestyle. It's not about losing weight. It's about the healthiest lifestyle. Some of the most traumatic doctor experiences I've had growing up, and even like 2-3 years ago, for example, would be providers telling me that I'm too heavy. And they didn't use words like that. They were actually quite mean. And I would never do that to anybody. So the way I talk to my patients, because I think they're beautiful and they're healthy and they're young and they're fertile, and that's how I see them, is that I want them to be as healthy as possible. So strength training, eating right, plant-based diet, all that kind of stuff, sleeping well, making sure that you have a normal circadian rhythm, make sure your relationships are in the healthiest state. And I came up, you guys, I know, I hear you saying it, another mnemonic, and that's the fertility team. So your therapist, your eating and exercise specialist, a nutritionist, acupuncture, mindfulness, and meditation. So preparing also means taking supplements. So supplements could be CoQ10. It could mean N-acetylcysteine if, for example, you have endometriosis. It could mean true Niagen, and let's say pterostilbene, resveratrol, I know I can say that again, resveratrol, there you go. And acai berry, if let's say you have decreased ovarian reserve. You can see that I have my certain recipe that I recommend to my patients. Ask your doctor what their recipe for supplement success is. Some people call it a supplement soup. I just call it my egg whisperer special sauce, and I swear it's magic. For some people it works, for other people it doesn't, but I really think at least taking a prenatal, CoQ10, vitamin D, fish oil, I know I just rattled off a whole bunch of stuff, but I only have 30 minutes here, and then adding in, for example, true Niagen and all the other things that I explained to you, and then ovasitol if you have PCOS. So remember, diagnosis before IVF cycle, diagnosis before treatment, test, don't guess, right? So if you have PCOS, you want to make sure your hormones are balanced and you've healed it. If you have endometriosis, talk to your doctor about, have you ruled out adenomyosis? Is it possible that endometriosis is affecting my tubes and I have hydrosalpinges, right? All super important stuff. So that's how we prepare. Healthiest, most sane, most relaxed that you can possibly be before going into your IVF cycle. And if you are in a partnered relationship, make sure your relationship is really, really strong. Take the time, take a break, take all the necessary, what am I trying to say? Measures to make sure that you guys are on the same team. And this is right for both of you. So now, IVF options, okay? Is fresh better than frozen? Is frozen better than fresh? Should I do this? Should I do that? I'll break it down for you. So you basically have 2 IVF options, transfer fresh or transfer frozen. Fresh means putting in an embryo about 5 days or even 3 after an egg retrieval. 5 days after an egg retrieval, that embryo is called a blastocyst. It has hundreds of cells. And you can also then freeze the embryos. Freezing means you now have 2 options, genetically test or not. I call genetic testing the murkiest of murky crystal balls, but it's the best we have. Think of embryos as diamonds. Embryos, like diamonds, can be beautiful on the outside and they sparkle, right? Diamonds sparkle too. But a diamond on the inside means a diamond is really good. But an embryo on the inside, when you're scrolling through the microscope, you can't see the chromosomes, and that's why genetic testing can help. So I know, I can hear you guys say it, she has now come up with another mnemonic, and it's true. And that's called Embryo Diamonds. So those are the 8 things you need to know about your embryos. So when you're about to do a fresh transfer, when you're about to do a frozen embryo transfer, when you're making decisions about what to do, remember the 3 questions and the Embryo Diamonds. The 3 questions that I always ask my patients: what do you want? What is it going to take to get what you want? And are you willing to do it? What do you want means how many kids do you want? And what is it going to take at the time of that fresh transfer? If you're doing a fresh, if you want, let's say 2 or 3 kids, and because of your age and everything that your doctor knows about you, you have 1 embryo, then you might want to freeze. Don't go into that fresh embryo transfer because you're not honoring the things that you want. So make sure you talk through those things with your provider, with your partner, and make sure that you're on the same page so you feel like you really made the right decisions for yourself. Back to Embryo Diamonds, the 8 things that you need to know about your embryos. What day were they frozen or transferred on? The implantation rate per embryo, whether they're abnormal, mosaic, and then with mosaics, find out from your clinic what their mosaic transfer and reporting protocol is before you do genetic testing. You don't want to be surprised that they won't report it to you or they discarded an abnormal embryo that could have been normal in the end if it was mosaic. Get all the official reports, all of them. stim sheets, ultrasounds. I love my patients to have their diamond binder. Ooh, diamondbinder.com. I need to look into that. And then we go to the N, which is how many are normal. The D, do these embryos help you reach your dreams and goals? And the S is sex. No, I'm kidding. The S is how is the sperm on the day of the egg retrieval? So now you have fresh and you have frozen. And with frozen, the two options, remember, freeze to genetically test or freeze to transfer. And now you have a decision to make is whether you want to do one of two things. I know my husband's always telling me, Amy, you give people too many options, but I just want people to know everything that's available to them without making any assumptions about what they would do, and just giving them, basically a roadmap, and then you get to choose your own adventure. I like the word adventure. I don't like other words, but like roller coasters, I try and keep it as a nice adventure with hopefully the best and easiest and most efficient happily ever after. Okay, you guys, so focus. Two things. You have frozen embryos to transfer or not. So we already talked about a little bit about the genetic testing piece, but to transfer or not means back to the egg whisperer diet. We got the D, diagnosis, I, IVF, which I kind of just talked through. E is embryo transfer preparation. Take your time. Talk to your doctor about what have you ruled out. Are my labs normal? Is my lining normal? Is my cavity normal? Why are you choosing the protocol to transfer that you're choosing for me? Is my progesterone going to be enough? How can you reassure me about that? Use the words, what have you ruled out? What have you ruled out? Just saying it over and over. Like, what do you see in this ultrasound? What do my hormone levels show you about me? Is there anything I can do to give myself the best chance of pregnancy before this transfer? Do you really feel that I'm going to give myself the best chance of transfer by doing it right now? And then the last question, the most important question, doctor, what would we do if this transfer didn't work? Because guess what? Sometimes you would want to know that because you might want to do that first before you do the transfer. For example, if I had a patient that just had one embryo and she was 42 years old, what we might do is do another cycle now. Like, you don't want to find that out after a transfer didn't work or you unfortunately had a miscarriage. You know what I mean? That'd be pretty annoying to think like, oh my God, like no one told me enough about ovarian aging and how important it was to do another cycle first. So embryo transfer preparation, we also have implantation testing. So I call that the mock cycle. You can do it with the ERA test or the receptivity X test or both. Talk to your doctor about what tests they do for their patients. So I do both. I think of the ERA test as the Evite to the funnest and best party. It basically tells you exactly what time to show up. And the receptivity X test tells me what to wear to the party. Basically, tells me what protocol I should use that will hopefully give my patient the very best success rate. So now the transfer, and you guys all know what a transfer involves. It's basically going to a lab, feeling relaxed, maybe doing a little something before and after, and that something is acupuncture before and after, and then getting that embryo home. The most important guest in your home, which is your uterus, is that embryo. You want to welcome it. You want to feel like you're well prepared, not overwhelmed, not stressed, or feeling rushed about any decisions you're making. And hopefully that embryo is going to do everything it needs to do, which is stick and grow. The next thing I want to talk about is dealing with a failed IVF cycle. And that is so, so hard. So what I tell my patients is, first of all, I'm really sorry, and you didn't deserve this, and you didn't cause this. And the thing is this, when my patients have a negative pregnancy test or a transfer that doesn't work, they know that I'm not going to bed at night unless I feel like I've given every single person their best chance of IVF success. I'm not doing a transfer unless I've ruled out and talked through all the things that I'm talking to you guys about right now. So it's so important to talk to your doctors too about these things before your transfer. Otherwise, you're going to be kicking yourself. Like, why didn't I ask that question? The problem is a lot of people just don't know what questions to ask. Okay, so now you have, unfortunately, a failed IVF cycle. I digressed a little bit. So you have to give yourself the space that you need to get through the moment. Don't make any big decisions. Don't throw everything away. Like, I've had patients do that. They throw everything away in that moment. I'm like, just don't do anything irreversible. Just know that your feelings will change, and give yourself space and, take the time that you need. But reconnect, regroup, and make a plan. And I always bring my patients in for a post-IVF consult within at least a week, or no more than a week from that transfer. So we can go through everything we did, everything we learned, answer your questions. I'll listen to your gut feelings on things, and we'll kind of talk through all the things that I've talked to you guys about. Ask your doctor the same questions. What have you ruled out? What can we do next? What's our plan? and then get excited and get hopeful and try again. And it's really hard to have hope right now, you guys. It's really hard to be positive. And that word positive can be super annoying, especially when you have family members that are like, just be positive and everything's going to work out. And you're like, yay, as if that was a thing. But I talk about hope as 4 things. I know, another mnemonic. Have only pragmatic and practical and positive expectations. Notice the first P is not positive, but I still want you to be positive, of course, but more so. Practical and pragmatic is the most important, and strong and resilient is why you guys are here and watching me today. So now let's just go to the good stuff. And that's when you're finally pregnant with that embryo and what to expect along the way. So the first thing to know is that you're going to feel anxious and you're going to feel worried and you're going to think that something's going to be wrong all the time. And it's going to be really hard to reassure you. So it's really important for you to talk to your doctor about how they can reassure you and what they can do to continuously reassure you that everything is going right. The things I do for my patients are HCG progesterone levels. I check them about 3 times and then once a week until the ultrasound. After the ultrasound, I ask my patients about how they're feeling and when they want to be seen again. And then I get them to their OBGYN, usually between 10 and 12 weeks of pregnancy. And then I tell my patients that I'm like herpes. I'm just kidding. It's not herpes. It's like luggage. I'm always there for you in your house and you know where to find me. So that if a patient has a question and they're not sure where to go because no one's answering them, then they know that they can reach out to me. If you don't have that kind of resource, it's okay. But make sure that you have a care team that's treating your pregnancy like a VIP, a very important pregnancy. Wow. I just talked a whole bunch about fertility and I can do it a whole lot more. And I hope you guys are all sparkling out there and I commend you. And I am so, what's the word I'm trying to use? I can find it. I can find it. I am so impressed by you that with all the things that are going on in the world, that you are working so hard to bring love into your life and into our world. Because I know everyone who's going to be a mom and a dad right now with what's going on is going to make this world a better place. And that's what gets me fired up. And that's what gets me showing up. And that's what gets me here to talk to you guys. So thank you guys again. Thanks for having me. And I hope you guys have a great rest of your day.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Ivf Options,
And you have yet another success story.
just launched by an East Bay fertility doctor.